Christina Nelson. She's a head of strategic partnerships at TytoCare. I'm wondering if you could provide a story about how health systems leveraging remote care to enhance the outcomes for the children that we're taking care of and their parents and their caregivers, and what strategies or tools have been most effective in improving care coordination and engagement.
As you look at pediatrics, those complex patients may only be 5% of the population, but they're actually 60% of that total spend for pediatrics. And quite frankly, these families are begging for digital solutions that allow them to have care in the home. These families are no stranger to medical equipment, so giving them a device like TytoCare to do an exam in the home is not foreign to them. It's very well received. We see a decrease in in-person appointments and unnecessary ER and urgent care visits, which is obviously a cost savings, but in some cases, it's actually saving lives. I was talking to Dr. Webster at Advocate the other day, and she was telling a story about a child recently that had presented with some fairly benign symptoms to their parents. So they called in and tried to get an appointment, but it was going to be a couple of days before they could get in. They switched gears, pivoted, and did a TytoCare visit from home. They very quickly learned by listening to the heart and lung sounds that this child was actually in respiratory distress and needed care immediately. Now, this has a happy ending. The child was taken care of, but had they waited, the child would have had a very different prognosis.